Hello, everyone. Welcome back to Healthy Talk, empowering your wellness one conversation at a time. Today, we're talking about a real handy tool that can help you manage your healthcare, the Boone County Hospital Health Portal. Joining me today is Kelli Flynn, clinical analyst at Boone County Hospital. Kelli, thanks for being here.
Thanks for having me, Rachel. I'm excited to let the public know about this.
Kelli, tell us a little bit about what you do as a clinical analyst at Boone County Hospital.
Absolutely. My job is about making sure our electronic medical records and health technical support work smoothly. A big part of that is making the health portal user-friendly, helpful for both our patients and our providers, and also to support our clinical staff side with them.
So you're basically the go-to person when it comes to making sure the health portal runs smoothly.
Yep. I work behind the scenes to improve the experience and troubleshoot any issues that patients or staff might run into, field phone calls, emails, and help make that improvement for us.
For those who haven't heard about the health portal yet, or maybe have heard but are not sure, can you explain what exactly is the health portal?
It's an online tool, 24/7. You can access that where patients can log in, see their medical records, lab results. You can request any upcoming appointments, and you can do that from your computer or your phone. We have an app you can also download on your phone, so that can be used at any time.
Sounds super convenient. Why was it created in the first place?
The goal was to make healthcare more accessible, really focusing on expanding this, helping the healthcare needs of our patients, and helping to be able to ease communication between their patients and their providers.
What kind of information can people see when they go into the portal?
So you can send a request through the patient portal for an upcoming visit, and then our front staff goes through and is able to give you a call. Whether you think about this in the middle of the night or anything like that, you can send us a message and we'll give you a call and get something set up. You can also send messages directly to your provider, which is handy as well. Like I said, in the middle of the night, or you have a different shift where the clinics are not open, you're able to send a message, and that goes to our nurses, which work through this workflow and work with the provider to be able to message you back or give you a call, let you know any answers that you need. You're able to check your lab results and any radiology reports. Those come right away. You're able to see those as soon as they're resulted. You don't have to wait for a phone call back.
That's nice.
No paper. So kind of getting rid of that and going more electronic. You're able to look at your visit summaries. So if you just saw the provider, as soon as they have documented, you're able to go in and look at your visit summary, look at maybe what orders they placed, any medications they've sent in. You're also able to look at your medication history. So if you're not sure what dosage you're on or the last time it was refilled, you're able to look at that. Your immunizations, you're able to also look at your billing. So if there's any billing that is current that is waiting for insurance to be pending, you can look at that and kind of look it through that process just a little bit.
I know we have the medication cards, which used to be the file of life cards for all your medications. Is this something that could keep track of all that too?
Yeah, absolutely. They could print that out and keep that in their file for life, or also be able to show another provider their patient portal where they have updated medications.
How simple is it for someone to sign up to start using Health Portal?
So it's pretty easy. As long as we have your email on file, that is our number one thing. We have to have an email address on file to be able to sign up. So if you run into not able to sign up, you can go out to our Boone County Hospital website and you can self-enroll. So all you need to really have is that email address on file. If you get not successful, then there's a phone number that you can call, and we will either put your email address on file, or you can call the clinic and they can address that as well. Once that email address is on file, then you can go in and self-enroll. If we enroll you through the clinics or the hospital, we can send out and generate an email, and you can go through that link and sign up as well.
Okay. And that's secure, right?
Absolutely. Okay. And we actually, to keep your security and privacy, everything that is transmitted from the EHR into our patient portal is encrypted until it gets through to the other end. Okay. So everything is secure.
One feature that the hospital has been promoting is proxy access. So how does that work?
The proxy access lets anyone that you would like to give access to your medical records. They can view, they can manage, they can assist. So we really encourage that with our elderly. If you have your family members or a caretaker or your children, what we would need is a form that's filled out, and the hospital or clinic can offer that to you, or we do have them online as well. You just need to get the patient's signature and then the information of the proxy, which means who's able to get access to that. We also have, you can set up your minor children. So if you have one patient portal, you can have as many patients on there as you want. So you could have your spouse, your parent, and all of your children and have access to be able to just toggle back and forth with one username and login. Once the child turns 12, they do get eliminated from your portal. And then either they can self-enroll, that is when we give them the ability to have their own, or you have to have the child then sign the proxy to be able to get back onto your patient portal.
Okay. Which I feel like most people would probably do. I feel like even in college, I was calling my parents and, wait, what blood type am I? I never knew any of that stuff.
Yes, especially with that young, and they only have school emails or anything on file that they might lose later, that we can get them signed up. And so as long as, again, we just have one email address, the child doesn't even need to have an email address on file. You just need to fill out the proxy form.
Okay. Are there any restrictions or anything proxies can't see?
No. So they're able to see everything. They can see billing and all clinical information.
Okay. For adult children caring for their aging parents, this sounds like a great tool and a way to stay on top of their care.
Yes, absolutely. Especially for anyone that is out of state or not local with their family. It helps caregivers, they keep up with the medications, appointments, test results. They get reminders as well. Having to be physically present for every appointment is very tough. And so it's a way to communicate and everyone gets on the same page rather than...
If you have a proxy, can you still see your own stuff too?
Absolutely. Absolutely.
What would you say is the most common issue that people run into with the portal, whether it's just using it or maybe during the sign-up process?
Yeah, I would say patients forgetting their password would be the number one.
Well, it's hard when you have 12 characters. You need a capital letter and a special character and a number, and it can't be the same as any of your last 34 passwords.
Yes. So I would say the password is very difficult or, keeping them, especially if they don't navigate it often or they don't have it saved. We also run into issues where you do have saved passwords on your phone. So when you go to update that, it's trying to pull in that old saved password.
Sure.
So we have a lot of issues trying to just start over. I would say signing up, we do have kind of a security. When you go to first enroll, there is just a generic username and password.
Okay.
And so then once you log in, then it processes and you can set up your own username and login. And that kind of catches some people sometimes because that's not my username. That's not my login. And I'm like, nope, just go ahead.
Keep going.
Yep. Go ahead and go into the next page and then it will allow you. And you also set up security questions.
Okay. If someone needs help, what should they do?
So we have a phone number. You can call us. The patient portal is a direct line. It is answered Monday through Friday. So if we're not available, we will return your call within a good 24 hours. But that is 433-8730. Or we have the Boone County Hospital website. We have a health portal tab that you can log on to. And there is an email address that you can link into there and send us an email directly.
Are there any cool updates or new features that you're looking forward to or want one day to be added to the health portal?
Absolutely. So right now we have a pre-registration process. It is not always the most efficient, but it is great. However, we would like to really expand on that and be able to use more functionality, be able to pay a copay during pre-registration. They are able to take a photo of their photo ID or their insurance card and be able to have that uploaded into our system. So parent sends with a grandparent or anything like that, they're able to pre-reg and get those on file. We really hope to expand that pre-registration process. And also we would hope to be able to give the proxy access a better process, and that should be coming, where if you are in the hospital, you can give temporary access to a user for a temporary time frame.
Okay.
It might not be forever, but they're your caregiver for a couple of weeks. You can literally give them just access for that little bit of time frame. So that is coming with some upgrades. It just really helps keep on top of your health records.
What would you say to someone who's maybe hesitant to start using the health portal?
I encourage you to give it a chance. There's just a really great tool to managing your health. And at any time, again, 24/7, it's at your fingertips. You have a question, you're not able to get a hold of your physician at that time. You're anxiously waiting for those lab results. Sometimes you'll get them before you're even back home or before you are back to the physician's office. And so you kind of have an answer. And it's nice. We're moving more to the technology side of things. And you're also able to get all of your access to your records. records. If you need a lab result to take to a specialty provider or someone outside of ours, you can print that and not have to
go into the doctor.
Correct. Absolutely.
Well, Kelli, thanks so much for sharing all this great info with us today.
Yes, thank you for having me.
Just another way that Boone County Hospital is helping out our patients and community. One last thing for our listeners, if you'd like a visual walkthrough of the healthcare portal, we have a video recording from a past Educating and Empowering You session where Kelli explains and demonstrates how to use the health portal. So you can check that out. It's on the Foundation's Educating and Empowering You, or EEU, page at boonehospital.com/foundation/EEU/videos. Thank you to all of you for tuning in today, and be sure to check out Boone County Hospital's health portal and take control of your health journey. Until next time, stay informed, stay healthy, and keep the conversation going with Healthy Talk.